If you're over 60, there's a good chance someone has told you, eat more fruit. It's good for your health. And for the most part, that's true. But what if I told you that one fruit, when eaten the wrong way, could quietly harm your brain, gut, and even your heart? I'm talking about papaya. Yes, that soft, sweet, tropical fruit that many seniors eat with breakfast or blend into smoothies. It's praised as nature's miracle. Good for digestion, full of enzymes, and light on the stomach. But here's the truth no one tells you. At our age, your body doesn't react to food the way it used to. And with papaya, just one mistake, just one, can trigger a dangerous drop in blood pressure, digestive distress, or even internal bleeding while you sleep. Over the past 3 decades as a neurologist, I've seen patients suffer from seemingly unexplained strokes, gut inflammation, and sudden fainting episodes, only to trace it back to something they thought was healthy, something like papaya. New research now shows that nearly all older adults make at least one of 7 critical mistakes with this fruit. Some of these errors are as simple as how you store it. Others involve dangerous food combinations, timing, or silent interactions with common medications. And the worst part? Most people never feel a thing until it's too late. Let me ask you something. Have you ever eaten papaya and later felt bloated, dizzy, or unusually tired? Have you ever wondered why some cultures strictly forbid papaya during pregnancy? These aren't just old tales. These are warnings passed down for a reason. Today, I'm going to walk you through the 7 most dangerous mistakes older adults make with papaya. And no, this isn't fear-mongering. This is about protecting your brain, your gut, your independence, and your life. Because the truth is, even nature's best foods can turn toxic if we don't adjust for the changes that come with age. So stay with me. You'll learn not just what to avoid, but how to keep enjoying papaya safely, so it supports your health instead of silently stealing it. And if you're watching this and find it helpful, let us know in the comments with a simple 1. If you still have questions, type 0, and we'll respond with personalized tips just for you. Now let's begin with the 7th mistake. It's hiding in your refrigerator right now. Mistake number 6, eating overripe papaya. There's something satisfying about a soft, sweet papaya. It feels like a gentle treat, easy to chew, comforting, and familiar. Many of my older patients even say it helps them feel clean inside. But here's the uncomfortable truth. Once papaya ripens past a certain point, it doesn't just lose its nutritional value. It can quietly turn toxic. And most seniors don't even notice the change until it's too late. When papaya becomes overripe, it starts to ferment. That's a natural process where the fruit's sugars begin turning into alcohol compounds. You may not taste it, and it may not smell like wine, but inside that soft fruit, bacteria are multiplying and fast. The Journal of Food Safety found that overripe papayas can contain 3 times the bacterial load of fresh ones. For someone with a healthy immune system, this might just lead to mild discomfort. But for an older adult, it can trigger violent food poisoning, intense diarrhea, or even hospitalization for dehydration. One of my patients, Mr. James Harlan, 76 years old, had always loved papaya. Every morning he ate a bowl of it, often leaving the leftovers for the next day. One Sunday he woke up with cramps, dizziness, and confusion. When he arrived at the hospital, we found signs of gut inflammation and a dangerous drop in blood pressure. Lab tests showed bacterial toxins in his bloodstream. The culprit? Overripe papaya left too long in the fridge. But bacteria isn't the only issue. As papaya overripens, the enzyme papain, the very compound that helps with digestion, begins to break down into new substances. Some of these can irritate the lining of your intestines. In sensitive seniors, especially those with IBS, leaky gut, or a history of ulcers, this irritation can lead to real damage. We're talking microscopic tears in your gut lining. That means nutrients stop getting absorbed properly, and toxins begin leaking into your bloodstream. The signs are often subtle: bloating, morning fatigue, brain fog, joint aches. You may never link them to the papaya in your fridge, but your body knows. So how do you know when it's too ripe? Look for flesh that's dark orange or red instead of bright, vibrant orange. If it smells fermented, or if the skin has soft, sunken patches, it's already started breaking down. The seeds should be firm and glossy, not shriveled or gray. And once you cut a papaya, consume it within 24 hours if stored in the fridge. Never leave it uncovered or sitting in its juices. And if you've already been dealing with gut issues, then be extra cautious. Your intestines are your body's gateway to the brain, the immune system, and energy. A single mistake with fruit that's gone too far can cause a ripple effect you might not feel until weeks later. So next time you slice a papaya, ask yourself, does it look like it's giving life or starting to decay? Because after 60, our bodies don't have time to clean up silent messes. Prevention is the new medicine. Now, if you think that was surprising, wait until you hear what happens when you mix papaya with the wrong foods. This next mistake is rooted in both ancient wisdom and cutting-edge science, and it's hurting more seniors than you might imagine. Mistake number 5, dangerous food combinations with papaya. Let me ask you something. Have you ever blended papaya into a smoothie with milk, added it to a fruit salad with oranges, or eaten it right after a full meal? If you have, you're not alone. These combinations seem healthy, even refreshing. But for older adults, they can quietly cause digestive distress, dangerous inflammation, or even internal ulcers over time. The reason lies in how papaya interacts with other types of food, especially dairy, acidic fruits, and cold water. Let's start with dairy. Papaya contains a powerful natural enzyme called papain. It's wonderful for digestion when taken alone, but when you mix it with milk or yogurt, something strange happens. The enzyme reacts with the casein protein in dairy, forming a thick, glue-like substance that's difficult to break down. In younger people, the stomach may handle it, but in older adults whose digestion has slowed and stomach acid is weaker, this mixture can sit undigested for hours, causing bloating, nausea, and in some cases, triggering allergic reactions. I once treated a woman, 72 years old, who developed hives and shortness of breath after drinking papaya milk smoothies every morning. We traced her reaction back to protein clumps that had built up in her gut and were irritating her immune system. When she stopped combining papaya with dairy, her symptoms disappeared. Now let's talk about citrus. Mixing papaya with fruits like oranges, pineapples, or grapefruits might seem natural, but you're combining two enzyme-rich foods with high acid levels. The result? A spike in stomach acidity is so strong, it can erode the protective lining of your gut. For someone over 60, especially those who already take medications that irritate the stomach, like aspirin or blood pressure pills, this can lead to ulcers or bleeding. A study from a European nutrition journal found that seniors who regularly consume papaya mixed with citrus had nearly 6 times the risk of developing gastric inflammation compared to those who ate these fruits separately. Then there's the issue of temperature. Drinking cold water or iced drinks right after eating papaya may feel refreshing, but it's dangerous. Cold liquids can instantly slow down digestion by shocking the stomach and solidifying the enzymes, forming jelly-like clumps that block nutrient absorption. One study showed a 65% drop in vitamin uptake when cold water was consumed within 30 minutes of eating papaya. So how do we fix this? Keep it simple. Eat papaya alone, preferably on an empty stomach, either in the morning or mid-afternoon. If you must pair it, choose fruits like banana or mango that digest at a similar pace and acidity. Never combine it with dairy, acidic fruits, or heavy meals. And always drink room temperature or warm water if needed. Your gut, especially after 60, thrives on simplicity, predictability, and balance. When you mix powerful enzymes, acids, and proteins, you're creating a storm your aging digestive system can't always handle. This isn't about fear, it's about wisdom, because what nourished you in youth could quietly harm you in older age if you don't adapt. Up next, we're going to talk about something even more alarming: the invisible poisons hiding in non-organic papayas. If you've ever bought papaya from a grocery store without checking the label, you need to hear this. Mistake number 4, ignoring deadly pesticide residues. You pick up a papaya at the supermarket. It looks fresh, maybe has a little sticker that says pre-washed or ready to eat. You rinse it quickly, slice it, and serve it with lunch. Seems perfectly fine. But what if I told you that fruit, especially papaya, might carry invisible chemicals linked to brain decline, hormonal imbalance, and even cancer. And worse, washing it with plain water does almost nothing to protect you. Here's what most people don't realize. Papaya is one of the most chemically treated fruits on the market. To grow fast and resist pests, many commercial farms use powerful pesticides, some of which are banned in Europe, Japan, and other developed countries due to their neurotoxic effects. But in the US and many papaya exporting regions, they're still allowed. Now think about this. Papaya has soft, porous skin. That means pesticides don't just sit on the surface. They soak in, deep into the flesh. So even after peeling or washing, traces of these chemicals can remain in the fruit you're eating. One study by the Environmental Working Group found that conventional papayas contain residues from up to 14 different pesticides, including some known to disrupt hormones and damage nerve cells. And the older your body gets, the more vulnerable you become to these toxins. Your liver, kidneys, and immune system don't flush them out as quickly. That means exposure builds over time. I had a patient, an 80-year-old retired teacher, who came in with worsening brain fog, fatigue, and unexplained mood swings. After ruling out common causes, we looked at her diet. She ate papaya nearly every day, non-organic, often from her local store. Her blood tests showed elevated markers of pesticide exposure. After switching to certified organic fruit and cleansing her liver gently with support from her doctor, her symptoms slowly faded. And here's another layer. Most of the papaya grown in Hawaii today is genetically modified to contain bacterial DNA that produces pesticides from the inside out. These GMO papayas are designed to resist viruses, but they also produce their toxins 24 hours a day in every cell. While some experts say it's safe, emerging studies suggest otherwise, especially for older adults with weakened detox systems. So how do you protect yourself? First, choose certified organic papaya whenever possible. It's not about being fancy. It's about avoiding chemicals your aging body can no longer process easily. If organic is out of reach, buy papayas from countries with stricter pesticide regulations like Mexico or Belize. And always peel your papaya completely. Never eat the skin. Discard the outer half-inch of flesh where toxins concentrate the most. Next, soak your papayas in a simple solution, 1 teaspoon of baking soda in a cup of water for 15 minutes. This helps break down some of the pesticide residues. Rinse well afterward. It may seem like extra work, but these small habits can protect your liver, your brain, and your hormones in ways you won't even realize until you feel clearer, more energized, and more balanced. Remember, at our age, every bite matters. We've earned the right to eat well, but more importantly, to eat smart. And speaking of smart eating, the next mistake is one I'm seeing more and more online, the papaya seed detox trend. But what most people don't know is that those little black seeds, when misused, can do real harm. Let's talk about mistake number 3. Mistake number 3, consuming papaya seeds incorrectly. They're small, black, and tucked quietly inside every papaya. To most people, they look like something to scoop out and toss. But recently, there's been a surge in online advice encouraging seniors to eat papaya seeds daily for detox, for parasites, for better digestion. And while papaya seeds do contain powerful medicinal properties, when used the wrong way, they can quickly turn from healing to harmful, especially in older adults. Let me explain. Papaya seeds contain a compound called carpine, a natural alkaloid with strong biological effects. In small, measured doses, it can help kill intestinal parasites, reduce inflammation, and even support liver cleansing. But when overused or taken daily without medical guidance, it can dangerously affect your hormones, blood pressure, and liver function. One study in the Journal of Medicinal Food showed that men who consumed even a small amount of papaya seeds daily for 3 months saw their sperm count drop by over 60%. In women, it triggered irregular menstrual cycles, even in postmenopausal patients, by interfering with hormone levels. Some women developed temporary infertility symptoms that took months to reverse. But the bigger danger, especially for seniors, lies in the liver. Papaya seeds contain another compound called benzyl isothiocyanate. This chemical is effective against parasites, yes, but in high doses, it's also a liver toxin. A study published in the Archives of Toxicology followed older adults who took 1 teaspoon of papaya seeds daily. Within a few weeks, 40% had elevated liver enzymes, a warning sign of liver stress. 3 participants even developed acute hepatitis and required hospitalization. Then there's the issue of blood pressure. The same carpine compound that affects hormones also has a strong hypotensive effect. It lowers blood pressure. That might sound helpful, but if you're already taking medication for hypertension, or if your blood pressure naturally runs low, this could lead to dizziness, fainting, or dangerous drops that affect blood flow to your brain. I treated a gentleman in his 70s who collapsed in his garden one afternoon. He'd been feeling lightheaded for days. We later learned he'd been taking papaya seed powder he bought online, following a YouTube detox plan. He thought he was cleansing his liver, but in reality his blood pressure had dropped to dangerous levels. Thankfully, we caught it in time. So what's the safe way forward? Papaya seeds are not meant for daily consumption. Think of them like medicine, not food. Never eat more than 5 seeds per day, and always chew them thoroughly to control how quickly they release active compounds. If you're trying to use them for parasite control, limit use to no more than 7 days, followed by at least a 2-week break. And never take them if you're pregnant, trying to conceive, or have any liver condition. For those sensitive to bitter flavors, a safe method is to crush a few seeds and mix them with a spoonful of raw honey. This buffers their potency and improves digestion. But again, no more than once every other day. At our age, moderation isn't just wise, it's life-saving. Your body is more sensitive now. Your systems are slower, more vulnerable to small changes. Don't fall for online detox fads without understanding the risks. Nature gave us these seeds for a purpose, but used carelessly, they can work against the very organs we're trying to protect. Now, if you thought these little seeds were powerful, wait until we talk about unripe papaya. It looks harmless, maybe even healthy, but one bite of green papaya, especially if you're over 60, could trigger a medical emergency you never saw coming. Let's talk about mistake number 2. Mistake number 2, eating unripe green papaya. At first glance, green papaya might look fresh, firm, even clean, especially in salads or health supplements. Some people even believe it's better than ripe papaya because it's less sugary or more natural. But for older adults, unripe papaya can be one of the most dangerous health traps hiding in plain sight. You see, when papaya is still green, it contains extremely high levels of latex, a milky, sticky substance that acts almost like a chemical irritant inside your body. And this isn't just theory. It's been documented in hospitals across the world, especially in tropical countries where papaya is widely consumed. What does that mean for you? If you have any kind of sensitivity to latex, even if you have never had an allergic reaction before, you could develop sudden symptoms like tingling lips, throat tightness, or shortness of breath after eating unripe papaya. But here's the alarming part. You don't need to have a diagnosed allergy for this to happen. New research from Johns Hopkins shows that 1 in 50 people has a hidden gene variant that makes them extremely reactive to plant-based latex, and they usually don't know it until it's too late. I'll never forget a patient of mine, a 68-year-old woman who tried a trendy Thai-style green papaya salad. Within 2 hours, she was in the ER, struggling to breathe. She had no food allergies on record, no prior reactions. But the latex in that one meal triggered a massive histamine response. Her body reacted as if she had been poisoned. And for pregnant women, the danger is even greater. Unripe papaya contains compounds that mimic prostaglandins, the same chemicals used in hospitals to induce labor. In traditional cultures, green papaya was used to trigger miscarriage. Today, many pregnant women unknowingly eat green papaya in salads, smoothies, or supplements, not realizing the risks. Multiple studies, including one in the British Medical Journal, have linked green papaya to early contractions and even pregnancy loss. Beyond allergies and pregnancy, there's another issue that's critical for seniors: gut damage. The latex in green papaya contains powerful enzymes that break down proteins, including the protective lining of your own intestines. If you have a history of acid reflux, ulcers, or leaky gut, this can cause microscopic tears in your digestive tract. Over time, that leads to chronic inflammation, pain, and nutrient malabsorption. And if you're taking blood thinners or heart medications, the damage can go even deeper. causing internal bleeding that's hard to detect until serious symptoms appear. So what's the safest approach? Simple. Avoid raw or unripe papaya unless it's been professionally prepared in a reputable restaurant. If you're at home, don't eat papaya unless the skin has turned mostly yellow and the fruit gives slightly under gentle pressure. Never eat it if the flesh is white or hard. And if you're pregnant or trying to conceive, avoid green papaya entirely, including powders and extracts. And here's a final warning. Many digestive enzyme supplements sold in health stores contain unripe papaya extract. Always read the label. If it mentions papain, chymopapan, or green papaya concentrate, ask your doctor before using it. Because after 60, your gut is not just a digestive tube. It's your immune system. It's your mood center. It's your brain's closest ally. And one careless bite of green papaya could quietly break down the very walls that protect your health from the inside out. Now, up until now, we've talked about what papaya can do on its own. But what happens when it combines with your medications, especially blood thinners or heart drugs? The result can be fatal. That brings us to the most dangerous mistake of all. Let's talk about mistake number one. Mistake number one, eating papaya while on blood thinners or antiplatelet drugs. This is the most dangerous mistake, and sadly the least talked about. I've seen it firsthand in my decades of practice, and it still shakes me every time. Papaya looks harmless. It's soft, sweet, and natural. But if you are on blood thinners, Zyhagam, such as like warfarin, Plavix, Eliquis, or even a daily aspirin, eating papaya could silently push your blood into dangerous territory. I'm talking about life-threatening bleeding, and the warning signs are often invisible until it's too late. Here's why. Papaya contains a powerful natural enzyme called papain. It helps break down proteins, which is great for digestion. But that same action also breaks down fibrin, a protein your body uses to form blood clots. In small amounts, this might not be a problem. But when combined with prescribed blood thinners or antiplatelet drugs, papain amplifies the effect, thinning your blood beyond what's safe. In medical terms, this spikes your INR level, a measure of how long it takes your blood to clot. The safe range for someone on warfarin is usually between 2 and 3. But I've seen patients hit an INR of 8.5 after adding papaya to their diet, turning a minor cut into a medical emergency. Let me share a real case. A retired nurse, 78 years old, came to me after experiencing dizziness and black stools. She'd been stable on blood thinners for years, but a few weeks before, she started blending papaya into her smoothies. Her labs showed internal bleeding. Her INR was off the charts. She had no idea papaya could do that. She thought she was doing something good for her digestion. Even worse, papaya doesn't just interact with blood thinners. It affects your liver enzymes, the same ones responsible for metabolizing dozens of medications, including statins for cholesterol, diabetes drugs like metformin, and heart medications like beta blockers. That means papaya can increase medication levels in your blood, making side effects worse. Some patients experience severe muscle pain, kidney strain, or dangerous drops in blood sugar, all linked to elevated drug concentrations when papaya is consumed too close to medication times. So what can you do? If you're on any medication, especially blood thinners, always inform your doctor before adding papaya to your diet. Avoid eating papaya within 4 hours of taking your pills. If you're preparing for surgery, stop eating papaya at least 2 weeks in advance to prevent uncontrolled bleeding. Keep a simple food and medication journal to help your healthcare team understand what might be affecting your stability. And remember this, papaya is not just fruit. It's biochemically active. That means your body treats it like a mild drug, and it deserves the same caution, respect, and awareness. The good news? You don't have to give up papaya forever. But once you understand how powerful it is, you can enjoy it wisely, in the right amount, at the right time, with the right knowledge. Coming up next, let's bring everything together. It's time for the final message, and how you can turn what you've learned today into a healthier, safer, and more vibrant life after 60. So let's recap. You've just learned 7 common but dangerous mistakes people over 60 make with papaya, most without even realizing it. From storing it in plastic to eating it overripe combining it with dairy or citrus, ignoring pesticides, misusing the seeds, eating it green, and most dangerously, mixing it with blood thinners. Each of these mistakes on their own can silently strain your body. But together over time, they can lead to fatigue, gut problems, hormone imbalances, internal bleeding, or worse. Here's what I want you to remember. Papaya isn't the enemy. Misusing it is. Your body after 60 is wiser but also more sensitive. What once felt harmless now needs to be reconsidered with care, respect, and a little science. The great news? You can still enjoy the healing power of papaya, its fiber, enzymes, and nutrients, if you use it properly. Start small. Choose organic when you can. Eat papaya ripe, fresh, and alone. Avoid risky combinations. Always tell your doctor if you're on medication. And most importantly, listen to your body. It's always speaking to you. You just need to slow down and hear it. If this video helped you understand something new today, comment below with a simple 1 so we know it made a difference. Or comment I'm a 0 if you're still unsure, and we'll answer your question personally. And if you care about protecting your brain, especially from strokes, there's one more thing you need to know. There's a common morning mistake that triples your risk of stroke after 60, but most seniors do it every day without thinking. To learn what it is, watch this next video right here. This morning mistake triples your stroke risk after 60. And as always, don't forget to like, subscribe, and share this with someone you care about. Stay safe, stay mindful, and keep living with purpose. You deserve to enjoy your golden years with energy, clarity, and peace.